Hi, my name is Paul. I am going to give you a candid kind of view from my world of my very recent open heart surgery. And I'm doing this in hopes that for some of you that are just seeking some additional information from a personal perspective, that I may have some additional insights or pointers for you. Certainly in scouring the web before my heart operation, I learned a lot from people that have gone through this. So here I am, by the way. My name is Paul. I'll talk into the camera. It is 2018, and on March 14th, which is now only about, today's the 25th, so it's been a week and a half that I had my operation. I went in at 5 a.m. on Wednesday morning, and it was about an 8 or 9 hour operation. I'm sorry, I didn't want to get upset. Okay, I'm not. I'm okay. It came out well. It's definitely a head trip. So this whole thing is geared more towards you that's having the operation. So I found out about 4, 5, 6 weeks prior to having the operation that I needed it. It was completely out of the blue, and I was having a problem with my eye vision. Short and the whole story is they have to inject a dye into your wrist and have the dye go up into your eye in order to profile your eye. Thank God my retina specialist was on top of it, and he said, oh my gosh, the dye's taking way too long to get from your arm to your eye. And he ordered me to go in for a carotid artery test and also correspondingly a echocardiogram. Those came back with the echocardiogram with I had severe aortic stenosis. So bottom line is, I guess my aortic valve was toast and clogged. I went, let's see if I can do this and stay together a little bit more. Sorry about that. Basically went to the cardiologist, and he told me you need to have your valve replaced. So for me, I didn't have any major symptoms that I was aware of, and hit me out of nowhere, the whole thing. And met with the cardiologist and said, you need to have your valve replaced. And I said to him, oh, can I eat some more Wheaties and do some more exercises? And he goes, no, I don't think you heard me. You need to have your valve replaced. Then I said, oh, it was like 6 months, a year, 5 years? And he goes, no, I don't make house calls on the other side. You need to get this done immediately. So anyway, it all began to sink in, and you can imagine if you're diagnosed out of the blue and you've had no history of it, it's quite a head trip. So I don't know what your story is, but that's my story. And hence the upcoming, few weeks turned into, a mental mind screwing, as you can imagine, for both me and my family. And I just want to tell you how I got through it and let you know that you will also. Okay? So they sent me back in for another round of tests, the TEE. That's where they put you under and they put the tube down your throat and they image the heart. Okay? So maybe you've had that done already. And they also do an angiogram. So those were done in one day in the hospital. As a result of those tests, I did not have any blockage in my arteries. I had additional damage that they were very concerned with, which is, if you know the heart architecture, the aorta comes up. That's a big artery that comes out at the top of the heart. And the ascending aorta was all swollen, so it was having an aneurysm. So that was, if you want to call it, the big panic to get in and get me operated on, because if that bursts, you're pretty much dead. And I've been walking around with that for God knows how long. So once we found that out, which is about a week after I went to the cardiologist, I went back in for these tests, then everything accelerated really quick, and I ended up meeting with the surgical team, in my particular case, over at Stanford University. Thank God for those folks. And a week and a half later, I underwent surgery, and I'll tell you about it. So let me tell you this with a little bit of post humor and, philosophical part of it. And, all right, I didn't mean to do that. Okay, so here's the story, okay? If it's freaking you out, it freaked me out too. So get over it, okay? So let me put it into type A logical perspective. It doesn't hurt a bit, okay? The biggest thing is the fear. So if you think about it, I've been in for one operation in my life, and you don't feel it. You go in, they put you under, and you don't know what the hell hit you, and you wake up on the other side. And if it doesn't work out, you don't wake up, you're not going to know the difference. So there is no pain, okay? So stick that in your head. So the biggest thing out of this whole thing is the mental head trip and your fear, and you got to get a grip on that, okay? Once you figure out that, you've been dealt your deck of cards, there's nothing you can do with it, and be thankful that there are people around that can operate on you, and today's technology is phenomenal. And the other big consolation in here that has to factor into it is look at the statistics for open heart surgery. Today, the success rate is phenomenal, okay? So you can read up on the statistics. I'm not here to give them to you. And by the way, I'm going to tell you this very clearly. Anything I tell you right now, this is not any medical recommendation or advice. It's purely my personal experience, but there are some things you should take note of. So here's what I did to get through this. So I'm in freak out mode. You get 2 weeks notice on your life. That's what it felt like to me. And you're looking at pictures, by the way, of my open heart. Doesn't bother me. I'm very detached on the whole thing. It's actually a pretty cool operation. So here's what I'm going to tell you. You need a way to de-stress. And for me, I had to get my life organized and, all your personal affairs in place. And while you're expecting the best, you need to prepare yourself and your family for the worst, right? You may not come out the other end. It's a major surgery. So do what you need to do. If you haven't got your will and your healthcare directive and your financial durable power of attorney, get it in place. $69 online. You can buy the Nolo Press Will Maker, done in 2 hours, okay? So get that out of the way. I started to type up a big list of all my financial accounts and all the stuff that I, supposed to have well organized and in place, and my life insurance policies. And of course, it's not all well organized, so you're in a bit of a panic. So what I did is I took to the video camera, as I'm doing now, and I recorded a walkthrough for my family of everything that was going on in our financial world, where the papers were, where copies of the documents were, pointed them to filing cabinets, and I walked through what I would do if I did not make it out the other end, okay? So as cold and morbid as it is, it's actually very stress relieving to walk through that on videotape with your family and let one of your family members videotape it, because they're part of this, okay? So as much as they don't want to hear it up front, believe me, it's a release to do it, and at least you can kind of get it done, and it's amazing what you can do in 15-20 minutes of video camera, okay? So that's what I did going up to it. Then I'm going to tell you that because this whole thing was such a shock, I'm a big boy, I'm a tough guy, but it got me. I was able to get my doctor to give me a prescription for, Avitan. It's a anti-anxiety. Do it, okay? It's a week and a half before. I took one of those stupid pills every night. It helped you sleep, to calm you down, so do it. Don't even think about it. As a matter of fact, and again, I'm going to tell you, this is not medical advice. You need to speak to your medical people, but my surgical team told me, great, take it, and two, they also wanted me to take it the morning that I came in for surgery, because they wanted me calmed down and relaxed. So I had surgery at 5 in the morning, and somewhere at 3 in the morning I was up and I took one of the Avitan pills. I'm sorry, I may be saying it wrong here, but it's an anti-anxiety pill. So let me tell you the experience. So you kind of get that pre-freak out thing, out of the way, get your affairs in order, get organized. Now let me walk you through what happened from my perspective, okay? They tell you to go pack a bag, bring pajamas, bring slippers, all this other happy horse shit. Well, I got news for you. Once you're in the hospital, you're in that, stupid gown where everybody sees your butt, and they give you those nice slippers that have the rubber grippies on them, and that's pretty much what I lived in. I didn't put my sweats back on and a clean pair of underpants until the day that I was discharged. So that's how much you should bring with you, which is not quite a lot, quite frankly. So let's see if I can share some other insights for you on what happened. So 5 o'clock in the morning, I'm supposed to be in the hospital. We went to a hotel that was closer to the hospital, didn't want to kind of hassle the stress and risk of having to drive 45 minutes on the day of surgery and having to call in and say there's an accident on the bridge. So we went over there. They tell you not to eat for whatever it is, 8-10 hours before. Don't eat, drink. So I didn't eat or drink before. And then we go in and show up at the hospital and go into the prep room. And really, it's no big deal. Lie down, get rid of your clothes, put on the gown. Hello, how are you? It was a little bit of a blur because of the stress. And I met with the anesthesiologist. And then I kind of now recollect that the surgeon came by to say hello. And shorten the whole story is, I don't know how long that was in the prep room, but it wasn't that long. They shave you and get rid of your body hair and stuff, where they need to do incisions and all that kind of stuff. And then, I kind of remember being wheeled down the hall, but at that point I was on an IV and they give you some type of sedative. I do remember being in the OR for just a short period of time. That's the operating room, looking up, seeing the big lights, and kind of talking with the anesthesiologist and joking about how much those big lights must cost. And then I pointed over to what was another pile of equipment, the perfusionist equipment, and how much that must cost. And after that, gone. I didn't know what happened. So the operation itself. So here's what happened. Now your poor family is stuck out in the waiting room. The operation is supposed to be 5-6 hours. I had to have an aortic valve replaced, and I also had to have, as I told you, because of the results of the TEE test, that I had the aneurysm of the ascending aorta. Well, I was also warned, nicely by the surgeon, that once he's in there, that it's not uncommon, or I forgot how it was phrased, that there could be damage to the arched aorta. So that's the part of the aorta that curves over, where the carotid artery comes in at the top. And he said if that needs to be done, you have a whole nother order of magnitude of complexity, risk, but don't worry, we've done plenty of those. And okay, so explain it to me. And if you want to hear the interesting details, the surgeon told me what they do is they put you in cryogenic suspension. They drain the blood from your head. They pack your head on ice. They do the procedure, and then they reboot you. Lovely. Okay, so what do I know? I'm not going to be there. So I go in, the surgery is done, and I wake up in ICU. All right, and I know the other part that was not very pleasant for my family is there was this chance of this arched aorta and this added level of complexity, and they had good communication for us from the operating room to the waiting room, and they said we have to do that extra procedure. So for 2.5 hours, my family was sitting there sweating it out, wondering what was happening to Dad. And by the way, it was my daughter, my son, and my wife, Mikey, my brother-in-law, and Cinda Lou, who waited in the waiting room. So all of that's done. I wake up, and all I can tell you is I remember coming to. I'm in the intensive care unit, and you're whacked out on all the drugs. I don't honestly remember any pain. I couldn't move a whole lot. It's like being in a science fiction movie, but all I can tell you is that you're kind of smiling, going, oh my God, I'm out the other end. So if there was anything that was on my checklist, it's opening my eyes and saying, okay, I'm alive, even though the success rate of these things is pretty damn significantly high. I think it's like over 96%, and even the 4% mortality rate is really for people that have a lot of complications before they even go in. So the odds are way, way stacked in your favor. So I had my surgery on Wednesday at 5 a.m. I got done at whatever it was, 5 p.m., something like that. My family was able to come in and see me when they brought me from the operating room into intensive care, but not for very long. So it was more like, okay, here he is. He's in one piece. And I had all the lovely tubes jammed down my throat, the breathing tubes and all that stuff that freaks everybody out. And then they said, they told my family, you're going to have to leave because we need to monitor him, and we don't want you in the room when we're pulling out all the breathing tubes. Not that there's anything horrible, but it's, I guess, not a fun-looking experience if you're looking at your family member that's having that done. But I didn't feel it. I'm cool. So as I said before, no pain so far. So I'm in ICU. It's out of Star Wars. All the monitors. They have more damn tubes and things inside of you. There's a dedicated intensive care nurse that's sitting on the monitor and screen, and it's you, the room, the equipment, and the ICU nurse, and you just never saw, at least for me, comforting wise, how many doctors, physician assistants, just all these people that came through to check on you, and it's all about the vital signs, okay? So just remember, it's all about the vital signs. There's nothing that you need to do, but they're there to, measure everything from blood pressure, heart rate, your heart rhythm. You'll read all about it, but it's all about the vitals. They're making sure that everything is getting restabilized and started up again properly. So, let me tell you a couple of things that I learned along the way that was very, very interesting, okay? Small little data points, no particular order. So one of the big things that they were monitoring and watching, and I'll use the word concerned, but not abnormal for a major heart operation, is that your heart rhythm is not what it's supposed to be. You're in what's called AFib, and you can go look it up, and basically your current heart rate's not syncing with where it's supposed to be. So what they do is they have a pacemaker, not inside of you. They have leads that go inside around your heart, and they have a box that's a pacemaker, and they use the term, it paces you. So they set it for the right rhythm, and if your heart doesn't do what it's supposed to, the pacer takes over, and you can actually feel the little electronic twitter in your heart. It's kind of a little disconcerting at first, but when you understand what it's doing its job.